These face masks are high in demand across the globe. In Yemen's capital Sanaa, a factory shut for 2 decades has reopened to prepare the country for the COVID-19 coronavirus. Even though so far, the country has reported 0 infections.
We have been pressured by the coronavirus emergency, and so the factory went into mask production with the resources available. We're helping to supply the masks in order to combat the effects of this outbreak.
Walk around the factory and the scars from almost 5 years of war are present. This old textile factory was hit by missiles in 2015.
We are in the textile area. The first missile hit here and created a hole 6.5 meters deep.
In the region, Iran has been worse hit by the outbreak, with more than 1,600 cases and more than 900 deaths. From there, the virus has slowly spread across the Middle East and North Africa, infecting at least 1,500 people. Now many of the countries affected have sealed off their borders in an effort to contain the virus. This week, Yemen's Saudi-backed government and Houthi rebels announced they would suspend flights to and from airports under their control, only allowing for emergency aid planes. But the most concerning area is a healthcare system that's been decimated by the war. Cholera infected more than 500,000 people in 2019 and pushed the healthcare infrastructure far beyond its limits. Where the WHO's advice has been to keep hands clean to prevent the spread of the virus, a researcher from Human Rights Watch asks on Twitter, how can people frequently wash their hands when the contamination of water has already led to the crippling cholera epidemic? And while Western countries are taking extraordinary measures against the coronavirus, the question is, can it be contained somewhere like Yemen, a country with a fragile healthcare system and torn apart by years of war? Burdon-Manley, Al Jazeera.